Okay, so I hope you have tried to attempt the mock paper which was provided. So today we will be discussing the questions out of the mock paper 1. Okay, so that's how we'll be starting today. Okay, so I hope you can see the screen. So we've had 100 questions, just like how the exam will be conducted. So that's how we have designed the questions. And in my case, I had picked out the questions mostly from previous papers and some questions from GPAT papers also. So can we go ahead and start the discussion if everyone is okay?
Yes, ma'am.
Okay, yeah, fine, okay.
Yes.
Fine, okay. So few questions we've already discussed in our previous class, but we shall still try to reiterate it. The questions have been, if you see there is a repetition in question, that means it has been important. It has come over plenty of times, so that is why we have repeated the questions. Okay, so let us go. Okay, so poorly manufactured tablets may have small pin-sized holes on the surface. The phenomenon is called. So I think this one also we discussed in the last class. So do I have answers from anybody?
Molting.
Molting or mottling? Mottling, okay. Yes, so it is mottling. So what is picking then?
Sticking to the machine or dice, no?
No, not exactly, not to the mission, but picking they usually say when there are 2 or more tablet forms which are sticking together, and it is mostly sticking towards the logo, if at all they have any logo or name of the drug, or there may be a partition in the drug also, right? So if in any case of that, you may see they call it as picking when the particles are towards the logo or central surface. So that is called picking. Leaching is actually, we do not have an exact phenomenon called leaching. So it is more of chemical substances which are being degraded away from the tablet or any capsule form, not capsule, tablet form. And cracking is, we can see just as the name suggests, small cracks which is seen on the tablets or on the peripheral surfaces. You may see a removal or any loss of a particle. Okay, so you may not see a uniform size of the tablet, so that is called as the cracking. So the answer for this is mottling. Okay, yeah. So next question. The Pharmacy Council of India is constituted by state government, central government, parliament, legislative assembly. So the answer is the central government. It is directly governed by the central government, and our roles and responsibilities of Pharmacy Council of India or any state pharmacy councils will be governed by the central government officials. Okay, yeah, we'll move on. Among the following preparations, which one will be the most irritating to the eye? So answers for this, anyone?
Purified water.
Okay, yes, purified water. Or okay, so the answer could either be purified water or 1% sodium chloride solution. In this case, why I have mentioned sodium chloride solution is because it may seem contradictory, but what they tell is within 0.9 percentage, then the solution is said to be isotonic in nature. But after 1%, after 0.9192993%, it becomes hypotonic. So in those cases, there may be an effect on the eyes, or there may not be effect on the eyes, but few researchers suggests that there may be swelling of the eyes when 1% sodium chloride solution is being used. So purified water, as you said, yes, it may seem right, but it is just an emergency use. For example, you have a canned water. If you have any irritation, you immediately tend to use it, right? So it can be used on emergency purposes, not as a sterile preparation, or not as a prescribed preparation. So in this case, we will be mentioning it as 1% sodium chloride solution. Just in case, if you do not have 1% sodium chloride solution as an option, then you can certainly go forward and tick as purified water. Okay, this may seem a little contradictory, but let us see in terms of pH of the sterile solution. So that should come into our mind, especially when it is ophthalmic or ear related preparations. Okay, fine. So let's move on to the next question. Okay, which of the following diseases can be transmitted by blood? Hepatitis B, HIV, syphilis, or all of the above?
All of the above, ma'am.
All of the above. Okay. Yes. So it is all of the above. Any contact with blood related products of from these diseases can cause can transmit the disease. Okay. Okay, fine. So let's move on to the next one. Pyrogens present in containers can be destroyed by heating the containers at, I think we discussed this last class also. So if you remember, you'll be able to
Yes,
answer.
ma'am.
Prabhu has told
Yes.
C. Okay. Yes, Priyadarshini?
Yes. Yes, ma'am. Last class we discussed this one.
We
Ma'am. So you
discussed
said 210 degrees Celsius for 4 hours because pyrogen will heat destroyed at a more temperature.
Correct. Okay. So that is a justification for the answer. So the answer is 210 degrees Celsius for 4 hours. Okay. So I just have one thing to tell you here. Sometimes in few research papers, it is mentioned that 210 degrees Celsius for 45 minutes is also enough to destroy the pyrogens. Okay. So the ideal method is for 4 hours, but this depends on the kind of materials that we use. In case of glass or in case of non-plastic ware, then for surely we can go for 4 hours. But if specifically they have mentioned about the material used, then we will have to look forward for the options. If at all 45 minutes is provided, and if there is any specific mentioning of the container, just be careful to answer it. Okay, so it should pyrogens means it is not 120 degree, it is always 210 degree. It's mostly 4 hours, but if it is plastic wares, then it will be 45 minutes. Okay. Okay, let's move forward. The loading dose of a drug is based upon the time taken for complete elimination, percentage of drug excreted unchanged, percentage of drug bound to plasma protein, apparent volume of distribution, and desired drug concentration. So what may be your answer?
Option B, no?
Option?
Apparent volume of distribution
Okay,
and
okay.
desiring drug concentration.
Fine. Okay. So what is loading dose of drug? Does all the drugs require a loading dose to be provided?
No, ma'am.
No? Okay. What kind of drugs do you expect a loading dose to be given?
This is a long release, I think so.
Long release. Okay, fine. Anything else? Can you just give me an example of what drugs require a loading dose? Very simple examples. In case of emergency use or in case of cardiac failure, a particular drug is given. Digoxin. Everyone's heard of digoxin in cardiac failure.
Yeah, congestive heart.
Okay.
Okay.
Yes, so there is a loading dose which has to be given in some what is it called, antibiotics. There may be a specification for a loading dose to be given. So loading dose is given when you have to increase the not increase, but you should just give a spike of release of the drug before the drug becomes in the steady state concentration. Okay, so it is usually a higher dose of a drug which is provided than the regular maintenance dose which is given. So for one time you give a loading dose, and the drug goes and it gets into the volume of distribution, and it will go into the drug in the plasma, after which you need to provide maintenance doses. Okay, maintenance doses will usually be of lesser dose of loading dose. So this is not given in all kind of drugs. Like I said, in emergency conditions or in not very simple infections, but in case of serious infections it has been given. So it is not time taken for complete elimination. So we are not talking about elimination. So there is no A and B goes out. Third one, percentage of drug bound to plasma protein. Before even binding to plasma protein, it should get into the distribution of our blood, right? So D is the answer for it. Okay, so let us move. What is the primary mechanism of action of local anesthetics? What may be the answer?
B, ma'am. Blockage of voltage gate sodium channel.
Voltage-gated sodium channels, yes. I'm also looking for another answer which could be which could also be given. There could be two mechanisms which is mentioned here, but primarily, as you said, be blockade of voltage gated sodium channels. But any other answer?
Option D.
Yes. Okay. Option D. Yes. Okay. So it could either be option B or option D, but in majority of cases, local anesthetics are usually given. I mean, usually they block on the voltage gated sodium channels. Okay. So this typically occurs in an exon level. So they do not let the sodium ions to move inside, which will block the response or pain responses, whichever is being transported to the brain. So that is being inhibited there, blocked there. Yes, blockade of GABA gated chloride channels also occur simultaneously, but the percentage in which sodium channels are getting blocked are slightly higher. So again, I know this may seem a little confusing, but why I have mentioned here is, in case such options are present, then you may have to think a little bit on the percentage of response. Okay, so higher chance, higher percentage that it is blocking the sodium gated channels. So you will have to answer that way, right? Okay, so let's move forward. In a hospital setup, PTC stands for Pharmacy Teacher
Pharmacy Therapeutic Committee.
Therapeutic Committee. Okay, very good. Pharmaceutic Therapeutic Committee. Can you give me, can you tell me who is responsible for Pharmacy Therapeutic Committee? Or what is the role of a Pharmacy Therapeutic Committee? Is it only for pharmacists? Or who else is involved? Any idea? Okay, so basically Pharmacy Therapeutic Committee is for all the healthcare professionals in a hospital setup. So it is not just for the pharmacists or any other people. It is for the physicians, for nurses, for all people who are dealing with drugs on a day-to-day manner. So what usually happens in a Pharmacy Therapeutic Committee is they have a list of drugs which has to be prescribed. So which we call as the What do we call the list of drugs which we have in a hospital? Any idea? Last class, I think we discussed about it. Or name? Hospital formulary, you remember? Okay,
Yes,
so
ma'am.
a
Yes, ma'am.
formulary will have all the available drugs which is particular to that hospital, and the physicians of that hospital will pick their drugs from the hospital formulary. So that is also coming under the therapeutic committee. It is one of the role of the physicians and pharmacists to develop this hospital formulary. Okay, so the answer is pharmacy therapeutic committee. Okay, the role of talc used in the tablet is it a lubricant, disintegrating, glidant, lubricant and glidant? What is it? D, lubricant and glidant. Okay, Prabhu is right. Any other answers? Do you think it is only a glidant? Okay, so why is a talc used in a tablet? Why should there be lubrication or glidant action?
Without sticking, it should come now.
Without sticking, it should come. Okay, from where?
From mold.
From?
Dyes or molds.
Yes, correct. So usually tablets are from powdered forms, right? So for the powdered forms to be non-sticky and to glide easier to the molds, it is used as a talc is used. Okay, so it was initially used in almost all the tablets, but now they are debating on the safety issues of talc, so it is not very commonly used. Okay, so it can also be a lubricant and a glidant. So D is the answer. Okay, so next one. Which one of the followings is tyrosine kinase inhibitor indicated for a variety of malignancies? So all of the drugs here is used for treating cancer. So which is a tyrosine kinase inhibitor here? Yes, I heard somebody answer, I guess.
Imatinib, ma'am.
Imatinib, okay. What kind of cancers does it treat? Imatinib. Okay, so basically it treats all the blood related cancers. So lymphoblastic leukemia and all it treats. Okay, so how it treats is the protein which is responsible for providing a signal for the cancer cells to grow and multiply. So this is being blocked by this drug. Okay, so tyrosine is a protein. So the inhibitor will block that particular protein for production or multiplication of the cancer cells. So the answer is imatinib. Okay, next one. If an infectious agent is transmitted through water, what type of transmission would this be considered?
Vehicle transmission.
Vehicle transmission. Okay. Anyone else? Yes, Rajalakshmi also has told vehicle transmission. Yes, correct. Vehicle transmission is the answer. So give me Prabhu also. Yes. Give me an example for droplet transmission. Any disease through droplet
TB.
transmission?
TB, ma'am.
Common cold.
Yes.
Common cold.
Cold. Yes, very good. Common cold is through droplet transmission. Okay, vector transmission. What is a vector transmission?
Malaria.
Yes. What is a vector transmission? That means yes, a particular organism is responsible. For example, a housefly or a mosquito. So they act as a vector, or they act as an agent for transmitting the particular disease. So that's why it is called vector transmission. Indirect contact transmission. Examples. Is it similar to vector transmission? Yes, actually, when there is no direct human-to-human contact, apart from it, anything is considered indirect contact transmission. So, vector transmission is also a part of indirect contact transmission. So, in this particular question, they've been asked through water. So, water is a vehicle. So, that's why we have answered it as vehicle transmission. Okay. Yeah. Okay. Cotrimoxazole is a combination of trimethoprim with sulfamethoxazole. Which of the following statement is correct about cotrimoxazole?
Contraindicated during pregnancy.
Okay, fine. We will talk more about what is cotrimoxazole and trimethoprim. So, which A, Balamurugan also says A. Okay, fine. So, which particular drug class does it fall into?
Antifungal.
Antifungal? Are you sure it is antifungal?
Antibiotic.
Just antibiotic? Just remember sulfamethoxazole. Then which class will it fall into? We have the name sulfa in front. Okay, so they basically are, they belong to a group of sulfonamide antibiotic. Okay, so it is not, maybe I think you must have mistaken by azole as the prefix, right? Because it was cotrimoxazole, you must have told antifungal, but no, this is sulfonamide antibiotic. It is primarily used in treating urinary tract infections or some kind of bronchitis. Okay, so why is there a combination which is to be given here? Why not only sulfamethoxazole? Why not only cotrimoxazole? Why is it usually that we have a combination of this drug?
If it alone give means it will be a bacterial static, ma'am. With trimethoprim we give means it will be bactericidal, it will kill the bacteria.
Okay, very good. So what is the name for it? Name for the term?
Bactericidal. Bactericidal.
Bacteristatic. Okay, but two drugs we are giving together, no? So what is it called? It is an antagonist or synergist? What is it?
Synergist.
Antagonist.
Yes.
Synergistic.
No,
sorry,
antagonist
synergistic.
is opposite of it. Okay, it is synergistic. So it helps in better efficacy of treating the disease. So, okay, tell me what concentration of sulfamethoxazole and trimethoprim is to be given? What dose ratio? So it should usually be 1:5 ratio. Okay, so option C, they have mentioned 5:1 ratio, but it is 1:5 ratio. Okay, so one part of trimethoprim and 5 parts of sulfamethoxazole. So it will provide a synergistic effect. So in another particular diarrheal condition also it is given. Can you tell me what diarrheal condition it is? Can you remember the name? Okay, so in case of traveler's diarrhea, this combination of drug is very helpful. Not in common diarrhea, but in case of traveler's diarrhea. Okay, so out of all these options here, yes, cotrimoxazole is contraindicated during pregnancy. Okay, let's move on. Hospital acquired infections are called
Nosocomial infections.
Nosocomial infection.
Yes, okay, very good. Right, answer is right. So, what are primary infections? It's just a normal infection that we get. So, we acquire some bacteria or some germ and we develop a fever or cough or cold. It is a primary infection. What is a secondary infection? When a primary infection is being treated, you develop another infection. So that is called a secondary infection. So what about latent infection? Any idea what is latent infection? Okay, so latent infection is basically where you have the germs or microorganism within you for a longer duration of time, wherein there will be no symptoms which is being produced. So it is more of symptomless infection. For example, you have chicken pox, varicella zoster. Okay, so it may be present in your body, but so it is in its latent phase. It is not in its active phase. Okay, so when it is activated is when you will start having those pustules, and sometimes it may result in fever. Okay, so that is called a latent infection. So but hospital acquired infections are called nosocomial infections. Okay, what is the common nosocomial infection in hospitals? Very common one. Pneumonia. Okay, hospital acquired pneumonia is a very common nosocomial infection, especially from the intensive care units. Okay, yes, let's move forward. Which of the following neurotransmitter is formed on demand and it is acted immediately? Is it acetylcholine, histamine, nitric oxide, adrenaline? Which is the one?
Nitric oxide.
Nitric oxide. Nitric oxide.
Nitric oxide. Okay, can you tell me why it is nitric oxide?
Because it carries acetylcholine.
Yes. Sorry, I didn't get you. Can you be clear?
It releases acetylcholine.
Yes, so it can be considered as a precursor also, one of the precursor. So it is not present in all the time. Only when it is required, on demand, nitric oxide is released and it is acted immediately. So the answer is nitric oxide. What is the fright and flight hormone out of these options? Adrenaline. Very good.
Adrenaline.
Okay, so what does histamine? When is histamine released? In what conditions is histamine released?
Allergy.
Yes, allergy. Very good. And every time you sneeze, there is a release of histamine, which causes the sneeze. Okay, fine. Very good. We'll move on. Okay. D-tuberculorin produces skeletal muscle relaxation by inhibiting.
Nicotinic receptor in neuromuscular junction.
Yes. Okay. Anybody else? Why is it basically used? In which condition is it used?
Skeletal muscle relaxation.
Yes. Okay. Earlier, it was used with a particular drug type. Which is it? Can you remember?
Non-depolarizing blocker.
Okay, but for a particular indication, it was being used. It is still being used.
Yes. In surgery.
Yes. What in surgery?
Pre-anesthetic medication.
Exactly. So it is given along with a pre-anesthetic medication, not very widely given, but earlier it was very widely given. So here what you have to remember is neuromuscular junction. Okay.
Yes.
So nicotinic receptors will be present in the neuromuscular junction, and D-tuberculorin will inhibit the nicotinic receptors in NMJ junction. Okay. So what are alpha adrenergic receptors responsible for?
Alpha adrenergic receptor agonist in glaucoma.
No, just basic. You tell me, what is the indication? Why do you need alpha adrenergic receptor? For your blood pressure regulation.
Nice, ma'am. Alpha blockers.
Yeah, so just think in that level for you to analyze more. Okay, so what about muscarinic receptors? So nicotinic and muscarinic receptors both are in parasympathetic nervous system. So in case of any secretions, they are helpful. What about ganglionic? They are again helpful in both sympathetic and parasympathetic nervous system. Okay, so they are especially present in the head, neck, and your pelvic organs. So the next question we'll move on to. Which of these does not contribute to development of antibiotic resistance?
Bacteria or phagocytosis by macrophages.
By macrophages, okay. Okay, yes, the answer is bacteria are phagocytosized by macrophages. But let us also see the other ones. Bacteria will get mutated, like virus, yes, it can get mutated. So that is not the one. Bacteria go dormant, yes, sometimes it may not replicate in the levels it needs to replicate. So that can be a result. And what is quorum sensing? Bacteria use quorum sensing. What is quorum sensing? Any idea? Okay, so it is a communication method which are used by bacterial cells. So they communicate between themselves in order to become resistant, or in order to be smarter than the way they were before, in order to change their the spike proteins or whatever is present on the peripheral surface. So this communication sensing, cell communication is called quorum sensing, and this is a very, very researched topic right now in terms of antibiotic resistance. So researchers are trying to figure out what the cell communication is happening. Okay, so the answer here is bacteria are phagocytosized by macrophages. So that does not result in antibiotic resistance. Okay, as per the Drug and Cosmetics Act, if a drug is not labeled in a prescribed manner, it is a
misbranded drug.
Okay, correct. Yes. Balamurugan is also says it is spurious drug. Okay. Okay, so it is misbranded drug. What is a spurious drug?
If the design or device which makes false claim of the drug.
Yes, false claim. So you do not have the desired ingredient in it. Okay, so that is called spurious drug. Substandard drug is when the government is or the Drug Cosmetics Act will have a particular standard, quality standards. When it is not being met, then it is substandard drug. Adulterated drug is wherein you have any other mixtures which is present in the active pharmaceutical ingredient which is not desired, is called an adulterated drug. So misbranded, as you said, the labeling is completely wrong, then it becomes a misbranded drug. Okay, good. Balamurugan, I hope you understood the difference.
Yes,
Okay,
ma'am. What I think only mistakenly came actually. I know.
Okay, no problem. Okay, if there is any question, you can ask. Okay.
Okay.
Yeah. Okay, fine. Thank you. Okay, which one of the following is not affected in respiratory tuberculosis? Pleural cavity, lymph nodes, pericardium, larynx.
Pericardium.
Pericardium.
Yes, very good. It is pericardium. So pleural cavity, as we saw last time, pleura is the covering of the lungs. So pleural cavity is just present beneath the lungs. Lymph nodes is present throughout the body. So tuberculosis can affect both. Larynx, again, it is a part of the respiratory system. Pericardium is where is it lining?
Heart.
Heart, yes. So that it is not affected in tuberculosis, in respiratory tuberculosis. Okay, fine. Heparin prevents blood coagulation by
inhibiting thrombin catalysis,
Strong is applied
conversion of fibrinogen to
to fibrin.
yes. Okay, so that is the basic mechanism of action of heparin. So it will inhibit the conversion of a fibrinogen to fibrin. So what will catalyze it, or what will help in conversion of fibrinogen or to fibrin is thrombin. So that is inhibited here. Okay. Fine, then let's move on to the next one. Which one of the following is an organ specific autoimmune disease? Graves, scleroderma, polyarthritis nodosa, rheumatoid.
Graves disease.
Graves disease. Okay, anything else? Sorry. How about scleroderma? Is it a rheumatoid? I mean, it is is it an autoimmune disease? Yes, it is an autoimmune disease. Okay, as you said, Graves is right.
Commonly, it affects women men.
Yeah, I couldn't hear you right.
It's a rare disease, no, that often affects women men.
Correct. Okay, so pertaining to this question, can we answer? Okay, scleroderma basically is a skin-related condition. It is a chronic condition. It may affect it affects primarily your skin, but some connective tissue and internal organs are also affected in this disease. What about polyarthritis nodosa? Which organ does it affect? It is very well there in the name itself. Arteritis.
Arteries.
Yes, arteries. So that means where? Especially in the heart. Okay. But it can travel elsewhere also. There may be other arteries which are getting affected. So it cannot be a localized condition. Rheumatoid arthritis, again, not a localized condition. So it comes to Graves' disease. So what is Graves' disease? Which organ does it affect?
Thyroid gland.
Thyroid gland. Yes, correct. So that is the answer. Graves. Okay, let's move on. Drug choice of amoebic dysentery is
metronidazole.
Yes. Yes, it is metronidazole. So it cannot be antibiotic. Penicillin G will not be given. Tetracycline is a very higher end antibiotic, again not required. Metronidazole is a basic one which is given for any dysentery, and especially amoebic dysentery. Yes. Okay, fine. Okay, use of isoniazid is restricted to ototoxicity, hepatotoxicity, neurotoxicity, bone marrow depression.
Neurotoxicity.
Okay, so what are the neurotoxic conditions which occur in isoniazid use? Neurological symptoms? Any idea? Okay, there may be confusion, there may be dizziness, and in some patients even depression for that matter. There will be irritability. So all these are neurotoxic symptoms of isoniazid toxicity. Okay. Okay, a particular vitamin is used to reverse isoniazid toxicity. Are you aware of it? Yes. Which vitamin?
Vitamin B6, ma'am.
Yes, correct. Pyridoxine. Okay, pyridoxine is used to reverse isoniazid-induced toxicity, especially isoniazid-induced coma. Okay, so here the answer is neurotoxicity. Okay, let's move forward. Okay, element that is not found in the blood is, okay, I have given the answer, chromium. So we have iron, magnesium and copper in blood. Chromium is usually not present in our body. Okay, probably in trace amounts, not very significant element. Okay, so it is chromium. Okay, the blood pressure and the pressure of blood is from where? From arteries, veins, auricles or ventricles?
Arteries.
Ma'am.
Arteries or veins?
Ma'am.
Arteries. Okay, so what does veins do? Yes, arteries is the right answer. What does veins do?
To carry impure blood.
They carry the deoxygenated blood. Okay, yes. So auricles and ventricles, what are they? They are just the chambers of the heart. Okay, so it is mainly arteries and veins. So the chambers of the heart are auricles and the ventricles. Okay, so the blood pressure is responsible through arteries only. Okay, so the blood pressure values of 4 people are given below. So which among the following has a normal blood pressure? And this must be a very easy one.
120 by 80.
120 by
20
80.
by 80.
Okay, so the answer is Mrs. X, 120 by 80. Okay, fine. So what is hypertensive crisis? What is the BP levels in hypertensive crisis? If it goes above 180 by 120, then it is called hypertensive crisis. Okay. So are you aware of the hypertensive emergencies? There are 5 hypertensive emergencies. So anything that you're aware of? Okay, just try to remember if possible. Okay, so 5 hypertensive emergencies are pulmonary edema, cardiac ischemia, neurological deficits, acute renal failure, aortic dissection, and eclampsia. So these are 5 hypertensive emergencies. Okay. Okay, fine. So let's move forward. Which of the following organ is used in purification of blood in human body?
Lungs.
Lungs.
Lungs, okay. Yes, okay. Lungs are is the right answer. What about kidney? Does it also purify blood?
It, ma'am, it cleans the blood of toxin.
Correct. Okay. So lungs are primarily involved in purification, but kidney is also helpful in purifying the blood. Okay. Okay, fine. Antidote for organophosphorus poisoning is
nitrous oxide.
nitrous oxide. Okay. Any other answer? Atropine is actually the antidote. Okay, so why is atropine used? What happens in OP poisoning basically? In any kind of poisoning, what is the first restoration that needs to be done? What particular symptom is seen in OP poisoning apart from excessive secretions? Do you see a reduction in cardiorespiratory function? Do you see a reduction in heart rate reduction? Breathing difficulties?
Yes, ma'am.
Yeah. Okay. So in order to restore it, atropine is primarily given. Okay, not nitrous oxide. Here it is atropine. Okay. Okay. So atenolol, why is it used? So it is to treat high blood pressure. Okay. How about tuberculosis? We already saw. Okay, nitrous oxide also we saw. Fine. Okay, then we'll move forward. Okay. So a sample of paracetamol tablet claims to contain 500 mg of paracetamol, but after analysis, it was found that there was only 200 mg. So what is it categorized as? It is a misbranded drug. I think I've mentioned the answer there, but you must have understood the question. So when there is a claim of a particular dosage, and if the label is wrong, or if the label is right, and if the analysis finds there is a mismatch in the label and the drug, then it is called as a misbranded drug. Okay. Actually, a lot of questions on misbranded drug kept coming in all the pharmacist exams. So you can expect, I guess. Okay, this also I have given. Okay, this we saw before also. I think it is repeated here. Primary mechanism of action of local anesthetic is by blocking the sodium channel receptors. Okay. So here nothing to deal with because we have already dealt. We'll go to the next one. Okay, the microorganism that can enter the body only through an injury is Clostridium tetani, Salmonella typhi, Clostridium botulinum, or Pyogens.
Clostridium tetani.
Okay. So what is the first injection that we get after we fall down, or after we after there is any blood which is coming through a cut?
Tetanus.
Tetanus injection. Okay, so it is Clostridium tetani. So it is a bacteria which immediately comes when there is an injury. Okay, so we tetanus injection, or it is, they also call it the TT. So the answer is tetany, Clostridium tetani. Okay, so tears contain an antibacterial enzyme known as
Lysozyme.
lysozyme. Okay. Any other answers? Yes, it is lysozyme. So what is zymase? Any idea? Is it, do you think it is present in our body? Okay, so it is basically obtained from yeast. So it is helpful in alcohol fermentation. Okay, so diastase, what does it do? It is present in our body. So it is responsible for breaking down carbohydrates. Okay, so especially if starch has to be converted to maltose, then enzyme diastase is very is responsible. How about lipase? What is lipase? Okay, it breaks down triglycerides into free fatty acids. Okay, so that is the enzyme which is responsible. So here for tears it is lysozyme. Okay, next one. While studying solid state physicochemical properties, the packing property of the drug include heat capacity, solubility, refractive index, or entropy. Which is the study you've done?
Refractive index.
Okay. Okay, why is it refractive index? Okay, so in this condition, in this question, they have mentioned about packing property of a drug. So if it is a liquid drug, usually it is packed in containers. It could either be glass containers or plastic containers. So refractive index is used to determine the stability of the container. Okay, and because the drug product is inside the container, how much light is being is being transmitted inside is also observed. Ultimately it deals with how the drug will be stable or not. Okay, so it is a refractive index. So other than this, I don't think we will see anything else apart from solubility. Yes, physicochemical property as solubility is being checked, but entropy, heat capacity is not pertaining to pharmaceutical preparations. Okay. Okay, fine. The term SARS stands for very common
Option B.
term. Yes.
Option
Okay.
B, ma'am.
Yes, correct. Okay, so it is severe acute respiratory syndrome. Sorry. So, what is the disease which we are seeing recently? COVID. COVID is a SARS-related disorder. Okay, fine. Okay, which of the following is commonly used as an abrasive in toothpaste?
Calcium carbonate.
Calcium carbonate. Okay. Abrasive. Okay, so it can be calcium carbonate, but not exactly as an abrasive. So they say calcium carbonate as an adsorbent it is used, but methyl cellulose is used as an abrasive in toothpaste. Okay. Okay, I was also thinking it was calcium carbonate, but then it is the adsorbent property of the toothpaste is through calcium carbonate. So the answer here is methyl cellulose. Next one. Which of the following drug is used to arrest premature labor?
Salbutamol.
Salbutamol, yes. How is it responsible? Okay, so it basically acts on the uterine muscles and helps in reducing the contractions which occur. So salbutamol is a drug. It is not very widely used, not as a go-to drug for arresting a premature labor, but it is there is an indication for salbutamol for it also. Okay, fine. Next one. Cephalosporins have this is in terms of chemical structure. So this I think we will just have to remember. So any idea what is the answer?
Ring fused with 6-membered diide.
6-membered. Okay, I heard A also. Okay, Prabhu says B. Fine. Okay, yes, it is a 6-membered dihydrothiazine ring. Okay, not a 5-membered. It is a 6-membered ring. It's a beta-lactam antibiotic with a 6-membered ring. Okay. Antidote for cyanide poisoning.
Sodium nitrite.
Okay. Yes, sodium nitrite. Can you tell me how sodium nitrite helps? Any idea?
Sodium nitrite.
Yes, sodium nitrite is the right answer, but how is it? What is the mechanism? So they basically compete with when you give nitric oxide, they compete with cyanide to bind with cytocrine's C oxidase. Okay, so it reduces all the actual effect of the cyanide which causes. So, but again, nitric oxide is not very effective. No, I mean, I wouldn't say it is not effective, but it has to be carefully used because it is very life threatening. It may cause toxicity. Okay, so next one. Okay, among the following, which is the largest size of capsule? 0, 1, 2, 0, 0. 0, 0. Yes. So size 0, 0. So if size 0, 0, 0 is given, then that will be the largest size of the capsule. Okay, so it is not based on 1, 2, 3, but it is based on the number of zeros. Okay, fine. Next one. Principle of liquid extraction is
Partition.
partition. Okay. Anything else? Okay, yes, it is partition. So when is liquid partition used? So basically when a particular solute is mixed with a solvent and you have to remove the solute alone, then that separation process is called partition. So you have a solvent in which solute is mixed and you want to remove out the solute alone. So that is partition. Okay, next one. Identify the right pair. Griseofulvin, bacteria, polyenes, fungi, colistin, fungi, macrolide, and actinomycetes.
Macrolide, ASST, actinomycin.
Okay, any other answers? Okay, so which is wrong here? Out of these options, which is, most of it are wrong. But what about Griseofulvin? What is it?
It's a fungus.
Yes, correct. Polyene and colistin?
Polyene bacteria. Colistin bacteria.
Colistin is also bacteria. Okay, so the right pair here is macrolide, actinomycetes. Okay, fine. We'll move to the next one. The precursor of bile salts, sex hormones, and vitamin D is? Yes. Yes, it is cholesterol. So cholesterol, it is responsible for production of vitamin D, sex hormones, and bile salts. Okay, so we do not exactly know the mechanism, but it's been found out that way. Okay, so let's move forward. Unopened insulin is stored at
2 to 8 degrees Celsius.
Okay, so 2 to 8 degrees Celsius. Where do we keep it in our refrigerator? In the freezer, on the shelf, where do we keep it?
On this
Shelf.
Which shelf?
Door shelf.
Side shelf. Yeah, door side shelf. Okay, so that will maintain up to 2 to 8 degrees Celsius. Okay, fine. In the process of extraction, ethanol is used as a solvent for?
Alkalides.
Okay, yes, correct. Alkaloids is the right answer here. Okay, so let's move. Okay, so this is again repeated, so we'll move to the next one. Okay, which one of the following drugs has positive ionotropic and negative chronotropic action? In the beginning of the class, I think I mentioned about this drug.
Digoxin.
Yes, correct. Digoxin. So what is ionotropic action?
Ionotropic action, cardiac output.
Okay, in simpler terms?
Heart rate.
It's basically how much it has to beat or how much it has to contract. Okay. And how about chronotropic action? What is
Heart
it?
rate. Heart rate.
Heart rate. Okay. So it must have a positive inotropic action. That means it should have a
Contract
higher
on
rate on your
cardiac output.
cardiac output. Yes. And negative chronotropic action.
Decrease heart rate.
Okay, fine. Next one. Which of the following, when taken by pregnant woman, causes a deformed child?
Thalidomide.
Yes, there was a huge controversy after using thalidomide earlier. So thalidomide, it causes congenital anomalies, especially
Left.
larger facial parameters are very much deformed. Okay.
Cleft nasal.
Yes, palate also. Cleft plate also, sorry. Okay, next one. Which of the following is not a bone in the human body?
Pericardia.
Okay, so it is a muscle. Others are bones. Fine. In which of the following disease housefly can act as a vector?
All of the above.
All of the above? Yes. So in any of these diseases, housefly can act as a vector. So it is a vector-borne transmission. All of the above. Okay, next one. The conversion of carotenoids to vitamin A takes place in eye, skin, intestine, liver.
Intestine.
Yes. So primarily absorption of vitamins and everything happens in intestine. So here also it's the same. So it is intestine. Okay. Next one. Long-term use of glucocorticoids will induce
Osteoporosis.
Okay. Yes, osteoporosis. Okay. Why osteoporosis?
Calcium level decreased. Hypocalcemia.
Okay. As such, does it reduce calcium levels?
Weakness of the long-term use of glucose.
Okay, so there is basically a bone loss which occurs. Okay, so not exactly calcium reduction. There is calcium reduction which happens, but there is also a higher. What happens is resorption. They call it resorption. It will stimulate the use of calcium, and it will cause a weakness. There will be rapid bone loss which occurs. So there will be suppression of bone formation, which will cause osteoporosis. So what is the other very, very common side effect of a corticosteroid? Increased blood glucose levels.
Hyperglycemia.
Yes, hyperglycemia. And there is another syndrome which occurs due to corticosteroid use. Not very common, but it is still present.
Down syndrome.
No.
Cushing syndrome.
Yes, very good. Cushing syndrome is caused by corticosteroid use, long-term use of corticosteroid, and not at the normal levels, at a higher dose levels. Okay, fine. Next one. Methotrexate is an antagonist of
Folic acid.
cobalamin, tocopherol, folic acid, riboflavin. Yes, folic acid. So methotrexate is used in indication of methotrexate.
Anti-metabolite in cancer. Anti-metabolite in cancer, rheumatoid arthritis.
Okay.
It is an immunosuppressant.
Immunosuppressant. So it is basically used in any kind of cancer. More of a primary drug for any kind of cancer and for rheumatoid arthritis also, methotrexate. So in case of lymphoblastic leukemia, non-Hodgkin's lymphoma, and even for some kind of psoriasis, methotrexate is used. Okay, fine. Okay, this is again repeated. Okay, the principle of gas liquid chromatography is Okay, again, pharmaceutical analysis question. This one is.
Partition.
Okay. Okay, yes, it is partition. Okay, so where do we use it usually? In what kind of analysis?
For example, PG analysis, propylene glycol.
Okay, correct. Anything else?
Fluorescein.
Okay, so why is it called gas liquid chromatography? Gas liquid.
Gas
So
is
what?
a mobile phase.
Yes, correct. So we inject a sample of a liquid sample into the chromatography unit, and we get it. So it is partition chromatography as a principle. Okay, fine. Which one of the following modes of HIV transmission carries highest relative risk of infection with single exposure?
Transfusion of blood and blood product.
Okay, anything else? Yes, okay, it is transfusion of blood and blood products. In fact, almost all the answers here cause a risk of infection, but highest risk will be transfusion of blood and blood products. Then comes syringe sharing with drug addicts. Then it will be sexual contact with infected partners and from mother to child. Okay, fine. But here they have mentioned single exposure. Okay, so it is transfusion of blood and blood products. Okay, let's move. Okay, this is also repeated, so we'll go again. Okay, sodium nitroprusside is one of the most potent blood pressure lowering drug. Its use is limited because of.
Ma'am, I have one doubt, ma'am.
Yeah, please tell me.
Previous question.
Okay.
Answer is purified water or 0.7 in.
Yeah, okay. So before also we discussed this, I think you were not here.
Yes,
so in such cases, what happens is until 0.9% sodium chloride, it is isotonic solution. Okay.
Yes,
so after 0.9%, it becomes hypertonic in this case. So here, in case of purified water, in an emergency use, you can still use purified water. If you do not have anything else, if you just have a canned water with you, in order to wash your eyes, you can use it, but it is still an irritant only. But in such cases with such options, when you have purified water and 1% NaCl solution, then we should answer in terms of isotonicity. Okay. So for example, if we had some other percentage of sodium chloride solution, for example 0.5% sodium chloride solution, then we will have to pick purified water as the answer here.
Okay.
So this is a little tricky, but here based on isotonicity, we will have to take 1% sodium chloride solution.
Purified water is demineralized water.
Correct, demineralized water, but symptoms based, 1% sodium chloride solution kudukrapo, there will be swelling in the eyes, which is seen. But in case of purified water, the incidence of symptom will be quite lesser. It will not be immediately happening. Okay. So if we do not have an option, and the water da namma kaila irukku, we have to wash out our eyes, then we can definitely go forward and use it. Okay. But when we have sodium chloride solution, then we will not go for it.
Industry la edhum kannla edhum patta kuda demineralized water vechi dhaan wash panna solluvaanga.
Okay. But, so that's what appa incidence namakku kammiya irukla.
Okay.
Okay, so basic incidence வந்து hypertonic solution நம்ம யூஸ் பண்ணும்போது eye inflammation அதிகமாகும்.
Okay.
So that is seen more in 1% sodium chloride solution.
Okay.
So just remember, as you said, purified water is also right. Initially நம்ம discuss பண்ணப்போ many of them told purified water, but just because the options are a little confusing here, we will go in terms of isotonicity. Okay. Yeah, fine. Okay, so sodium nitroprusside is a blood pressure lowering drug, but why is the use limited?
Short duration of
action.
Okay, correct. Very good. It is short duration of action. How quickly does it act and finish its action?
10 to 30 minutes.
Actually, 3 minutes.
Oh.
Yes, within 2 to 3 minutes, the drug action of the drug occurs. and within 20 to 30 minutes it will reach its half-life, and within 2 to 3 days it will get completely eliminated from the body. Okay, so it is a short duration of action. So that is the answer. Okay, the hormone responsible for secretion of milk is
lactogenic hormone.
yes. Okay, so lactogen, we know it is responsible for milk, so lactogenic hormone. Okay, next one. Classical pathway of complement is activated by
Antigen antibody complex.
yes. Yes, antigen antibody complex. See, in case of complement pathway, then it means something related to our immune system. So anything related to immune system, the first thing that has to come into our mind is an antigen and an antibody. Okay, so what is responsible for a pathway? Then it is an antigen and antibody complex. So it should be antigen antibody complex. Okay. The chemical used for fumigation of rooms is
Formaldehyde.
okay. Yes, formaldehyde. Even now for sterilizing our office spaces or hospital environment also, formaldehyde is very, very commonly used. Okay, fine. A polyene antibiotic here is
Amphotericin B.
okay, correct. Amphotericin B. So in what cases some disturbance is there? Yes, okay. Can we just mute once for people who have unmuted? Can you mute yourself once? Okay, so what about amphotericin B?
It is an antifungal drug, systemic infection.
Systemic infection, okay. Very specifically, can you tell me in what kind of fungal infection it is used? So in case of very severe fungal infections called as invasive fungal infections, meaning infections which can be life-threatening, then amphotericin B is used. Okay.
Filariasis also.
Yeah, filariasis, then even leishmaniasis, it is used. Okay. Okay, fine. Let's move forward. Okay, the drug price control order was exercised by the central government in 1995. Okay, fine. Yeah. Filter sheets made of cellulose is what filter?
Membrane filter.
Membrane filter.
Yes, so very commonly used even in our school level biology also, we know cellulose is used for membrane level filtration. So in terms of not very small particles, but moderate particle filtration can be done through cellulose. Okay. Okay. So CD4 antigen is present on T helper, macrophages, monocytes, all of the above. Where is CD4 antigen present? Macrophage, okay.
All of the above.
Okay, yes, all of the above. So it is basically present in T helper, macrophages, monocytes, in almost all the immune cells. This is present. Okay. So where is very low CD4 antigen observed? In which particular disease it is? It's a classic marker.
AIDS?
Yes, AIDS is very, very common. Okay. CD4 count is very much preferred marker for the disease progression or severity. Okay, fine. So the animal used for monoclonal antibodies are
Mouse.
is the mouse. Okay.
Okay.
Yes. Okay. So the answer is mouse. It is basically because they say their system mimics our human body system. So it is being experimented in mouse. Okay, glycogen is present in all the body tissues except
Brain.
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 Okay, why brain? Answer is brain, yes. Why brain? Okay, in other systems, you can actually store glycogen. So as and when required, it can be used. But brain does not, as such, have a storage unit for glycogen. Okay, only in very very on demand, if it is required, it utilizes. Other organs will have, or other tissues will have a storage organ also for glycogen. Okay, fine. Okay, so what is enalapril?
AC inhibitors.
Yes, ACE inhibitors. Okay, correct. So it is basically, it is a first line treatment for hypertension. So it is basically for reducing your blood pressure, enalapril. Okay. Any other drugs for, ACE inhibitors, any other drugs? Drug names?
Captopril.
Captopril, ramipril. Okay. Yes. Okay, fine. Yeah. Okay. This also, I think we discussed in the first class. Dimethyl sulfoxide acts as a penetration enhancer for topical formulations by
Denaturing proteins.
Okay, fine. Yeah, denaturing proteins. So which protein is present in our skin? Keratin. Okay, keratin along with some lipids are present on our skin, and it needs to be denatured to enter inside, to peripherally enter. So that is a penetration enhancer. It is by denaturing proteins, it enters inside. Okay, the major property of Ayurvedic herbs, rasa, indicates what?
Taste.
Taste. Okay, so it goes by the name, so it is taste. Next one. Blood plasma and blood serum preparations are dried by
Freeze dryer.
Freeze dryer. Okay, so why is it dried? For what purposes it may be dried? Specifically for
coagulation வராம இருக்கிறதுக்கு.
coagulation வராம இருக்கிறதுக்கு, yes, okay, but other than that, for even for isolation of DNA or RNA, it is dried, freeze dried, and it is very intact when it is freeze dried. When it comes to other methods, vacuum, spray, or fluidize, we usually don't use, but vacuum or spray method, when we see, there is a lot of loss of other cells. Okay,
So,
but
thermolabile substance.
yes, freeze drying will keep it very intact. So it is used. Okay, so in one of the following solutions, metabolic acidosis does not occur. Which one is that?
Production of less amount of lactic acid.
Okay, any other answers? Yes, actually, production of less amount of lactic acid will not attribute to metabolic acidosis. So uncontrolled diabetes mellitus, yes, it can cause. Acidazolamide, not to a larger extent, but there is incidence. In case of any form of acute or not acute, but in case of chronic renal failure, there is a pH level disturbance and bicarbonate level disturbance which occurs. So metabolic acidosis occurs. So can you give me example of drugs which will cause metabolic acidosis? Common drugs? Metformin, yes. Okay. Anything else apart from metformin? Fenformin, okay, but it is not in use, no? It has been recalled. Fenformin, metformin, okay. Actually, ACE inhibitors also can cause metabolic acidosis. Okay.
Okay.
Okay. And even some antacids, when used for a longer duration of time, especially when it has sodium bicarbonate in it. It can cause metabolic acidosis.
Metabolic acidosis ஆச்சுனா alkalosis கொடுக்கணுமா மேம்?
Yeah, you have to alkalize it. Yeah. So a lot of liquids.
Sodium bicarbonate injection அந்த மாதிரி.
Sodium bicarbonate.
Alkalizing agents.
Yeah, alkalizing agents can be given, but in the conditions they will have to figure out why exactly metabolic acidosis has occurred. So in case of renal failure, they will have to figure out what maybe there is an imbalance in sodium or potassium levels also. So that also needs to be treated first, and then metabolic acidosis will be treated. Okay.
Okay.
Yeah. Okay. Latin term gutatum means the following.
Drop by drop.
Yes, drop by drop is the right answer. We'll move to the next one. The drug concentration between minimum effective concentration and maximum safe concentration is called what?
Therapeutic index.
Therapeutic range.
Therapeutic range.
Okay. So it is usually therapeutic range, but therapeutic index is also quite right. But generally we use it as therapeutic range because here they have mentioned minimum effective concentration and maximum safe concentration. So we use it as therapeutic range. So
therapeutic index LD50 divided by ED50.
ED50. Actually, even for therapeutic range also, some of them claim LD50 by ED50 only. But primarily it is therapeutic range. So what about therapeutic ratio?
Therapeutic ratio.
It is something related to toxicity.
Oh, okay. Therapeutic index is safety.
Yeah. Range you can say efficacy. Ratio is based on toxicity, meaning at a particular concentration the drug will become toxic. So that becomes therapeutic ratio.
What is the difference between the index and range?
Therapeutic index and range. Okay, so therapeutic index we usually use it for safety of the drug. Okay, so therapeutic range we may use it for efficacy of the drug. So at what particular interval there will be maximum efficacy. Okay, so for us to get the desired effect, that we can use it for therapeutic range. Okay, yeah. Okay, which one is not an opioid receptor?
Gamma.
Yes, kappa, mu and delta are opioid receptors and gamma is not a opioid receptor. Okay. Glargine is, what insulin is glargine?
Long peakless.
Intermediate.
Peakless.
Okay, it is peakless insulin. So what can you call it otherwise?
Long
acting insulin. Yes, usually long acting insulins are peakless insulins. So they may not have a desired peak or desired peak. They will not have to achieve a particular peak. So they will be very slowly releasing their glucose. Insulin levels, not glucose, insulin levels. Okay. So example for short acting insulin? Okay, Actrapid, Lispro, yes. Okay, intermediate? NPH insulin?
NPH, glues, NPH.
Okay, so do we have oral insulin?
No, ma'am.
No, we don't have oral. Okay, so have you heard of inhaled insulin?
No, ma'am.
Okay, so there is inhaled insulin. There is only one insulin which is called Afreeza. Okay, so that is given through inhalation method. So it is not, it is still being figured out for its efficacy, but it is an preparation which has come into the market. Oral insulin again is in research. So, but as of now, we do not have any pharmaceutical formulation. Okay, so next one. In case of hypothyroidism, the preferred thyroid preparation is
Levothyroxine.
yes, levothyroxine. So that is the only most common drug of choice in hypothyroidism. Okay. Which of the following neurotransmitter is formed on demand and act immediately? So this is also similar to previous question.
Nitric oxide.
Nitric oxide, yeah. So we saw it before only. Okay. Okay, the term capsule is derived from capsula, from
Latin.
Latin term. Okay, fine. Latin term. Next one. Lozenges are what
Solid.
type of dosage form?
Solid.
Solid? Okay. Any other answers? Okay, yes, it is a solid dosage form. So, what are lozenges also called as?
Okay.
Troches. Yes, they are also called as troches. Okay, fine. Okay. I think I've mentioned here a semi-solid dosage form. It is a solid dosage form. I'll correct it here. Okay. Okay. Which one of the following statement is true for cancer cell? Options. Oncoproteins produced by cancer cells act as neighboring cells. Cancer cells require stimulation by growth factors. Cancer cells are highly sensitive to growth inhibitory signal. Cancer cells produce oncoproteins in absence of growth factors or external stimuli. Which may be right answer?
Option A.
Option A. Do they act as neighboring cells?
Option D.
Option D. Yes, actually it is option D. So you do not have, you do not require any external stimuli or growth factor for cancer cells to multiply. Okay. So it will automatically produce and start multiplying on its own. They do not act as neighboring cells and they do not require any growth factors for stimulating them. And they are not sensitive to growth inhibitory signal also. So because of this absence of external growth factors or external stimuli, it is very difficult to manage cancerous cells. Okay, so there is no particular target drug which can completely terminate the production of or multiplication of cells. Okay, so the option is D. Okay, why is subcoating given to tablets? We saw it in last class.
To increase the bulk.
To increase the bulk. Okay, fine. Yeah. Next one. Method of studying drug distribution pattern is through?
Mass spectrophotometry.
Yes, mass spectrophotometry. Again, an analysis question. So, where is nuclear magnetic resonance used?
Fluorine.
MRI machines in hospitals. And NMR technique is used there. Fluorimetry, not much.
Direct fluorescence compound. Fluorescence.
So, but not very much into pharmaceutical preparations. UV visible spectrometry, yes, to analyze any particles, it is used. Okay, so but here for drug distribution pattern, it is mass spectrophotometry. Okay, next one. Which one of the following is not the biochemical marker of all death? So just see, this question is a little, I don't know how to explain it. So, but you can see in terms of molecular marker or not molecular marker, biochemical marker, where do you see creatinine kinase? Where do you see phospholipase, lipase, amylase? In that way you can see. Okay, so actually the answer is phospholipase. Creatinine kinase, where do we see it? In which kind of any injury. See, biochemical marker usually is produced when there is any disease occurring to an organ. Okay, so there is an increase in the production of the markers. So where is creatinine kinase seen?
Liver?
No, it is in kidney. Okay. So when there is any kidney related acute renal failure or any acute kidney injury, we can see creatine kinase increase or reduction here. Lipase, where is it seen? Lipase is in cholesterolemia levels. Okay, it is seen there. Amylase, where is amylase seen?
Mouth?
Yes, mouth, but in which conditions do we see it? In which particular organ we see there is an amylase increase? In case of acute pancreatitis. Okay, so amylase levels will, even lipase levels also will increase in terms of any injury to pancreas. So phospholipase as such we do not see in any particular organ. So it is not a marker for death. Here when it means death, it is not the ultimate death. It is the cell death. Okay, so it is a disease severity or disease progression which is happening. So the answer here will be phospholipase. Okay, next one. Duodenum is situated?
Part of the small intestine.
Okay, I think we discussed this last class also. Uppermost part of small intestine. Okay, fine. Surfactants are characterized by the presence of negative, positive, water soluble and fat solubilizing group.
Option C. Water
Yes.
fat soluble group.
Yes. So it is water solubilizing and fat solubilizing group in the same molecule. So why is surfactants basically used? In what kind of products do we see for surfactants?
Suspension, emulsion, shampoo.
Shampoo, yes. Basically for what one particular reason they add a lot of surfactants. Why is it?
Suspending agent.
Suspending agent, yes.
Emulsifying agent.
Okay, but visually what happens when you add surfactant?
Fourth.
Yeah, froth and foam is produced. Okay, so especially in shampoos or detergents.
SLS is a surfactant.
Yeah, so there is surfactants used. So the answer here is C. Okay, fine. Drug products that contain same therapeutic moiety but as different salts, esters or complex are called as?
Pharmaceutical alternative.
Okay, correct. Pharmaceutical alternative. If they have mentioned anything about pharmaceutical action, then we may pick on to therapeutic equivalent or therapeutic alternative. Here it is in terms of salt and therapeutic moiety. Okay, same therapeutic moiety. So it is pharmaceutical alternative. Okay, fine. Crystallization of sucrose is due to? Saturation. Okay, so what is the common household example of crystallization of sucrose? Especially bottled juices which contains a lot of sugar. When you keep it for a long term, you may not be able to open the juice bottles. You may see a thick layer of crystals of sugars, right? So that is due to the excessive saturation which has occurred. Okay, so that is the answer here. Glucose is the only source of energy for one of the following out of these. Which is it?
RBCs.
Yes. Any form of erythrocytes, glucosides is the only source of energy. For the other cells also, glucose along with other elements can be used. For example, sodium, calcium and all. But RBCs solely rely on glucose. Low-dose aspirin acts as an antiplatelet aggregating agent by which of the mechanisms?
Option A, COX-1 enzyme.
COX-1, okay. Anything else? Okay, so what is suicide substrate? Yes, answer is COX-1. It acts as a suicide substrate for COX-1 enzyme present in platelets. So what is suicide substrates?
Substrate.
Okay, so as the name suggests, suicide is what? Reversible or irreversible?
Reversible.
Irreversible. Okay. So
Okay.
any particular mechanism where it is an irreversible inactivation of an enzyme, if it is happening, then it is called suicide substrate.
Some clavulanic acid in beta lactamase inhibitor.
Correct. Yes. They are also suicide substrates. The term is not very commonly used because now we use antagonists or inhibitors, but it is still valid. Okay, especially in designing of drugs, these terms come into picture. Okay, so here for antiplatelet aggregation, COX-1 enzyme is to be inhibited. Okay, so that's the one. Emulsion is a dash liquid.
Biphasic.
Yes, biphasic liquid. Okay, fine. Okay, so what is calamine? Zinc carbonate, sulfate, oxide, or none of these? Okay, zinc oxide. Okay, so basically it is zinc carbonate. Zinc oxide is present usually in ointments which has ointments which cure wound-related infections or burns. You know, if you have to cure them, then zinc oxide is used. So zinc carbonate, calamine is basically used for what? One, moisturizing. Second one, another one. It helps in reducing itching. Okay. So zinc carbonate is responsible for the reduction of itching. So the answer here is zinc carbonate. Okay. Dextromethorphan used in cough syrups as?
Cough suppressant.
Yes. Suppressant. Okay. Cough suppressant. It is known. Okay, fine. Okay. Which digestive enzyme is produced in salivary glands and pancreas? We just saw now.
Amylase.
Amylase. Okay, fine. Yeah. OPD refers to?
Outpatient.
Department.
Yes, outpatient department. Okay, fine. So, which of the following element is used in contraction of muscles?
Calcium.
Element. Calcium is used. Yes. Okay. Calcium along with magnesium also, but primarily calcium is used. So, hospital formulary consists of?
List of drugs to be prescribed.
Okay. Yes. List of drugs to be prescribed. So, again, it is constituted by which committee? Pharmacy Therapeutic Committee. PTC. Okay. Yes. Okay. So, next one. Which of the following emulsifying agent is from a plant source?
Pectin.
Yes. Okay. Pectin is from a plant source. Next one. Which of the following is used in oral cavity? Pouches or lozenges. They are used in the oral cavity. Fine. So, who is the chairman of Drug Technical Board?
Director General of Health Service.
Okay. Yeah. Okay. So, Director General of Health Services of a particular state usually is the chairman of Drug Technical Board. Okay. So, we'll move to the next one. Milk of magnesia is used as?
Antacid.
Okay. So, that's also a common answer. Okay. Antacid. Okay. So, the last one. Cetramide cream is used as a? Bactericide. Okay. So, what does cetramide cream consist of?
Cetrimide is an active. It also AP. Cetrimide and chlorhexidine.
Okay, so in another, okay, there is a combination of a cetrimide cream along with a particular pharmaceutical agent, which is very commonly used.
Benzoic acid.
Bernol, we've heard of Bernol, everyone. So
Silver sulfadation.
aminacrin. Okay, it is called aminacrin. So it is very commonly used cetrimide cream. Otherwise, okay, in along with chlorhexidine also it is used.
Yes, ma'am.
As an antiseptic cream. Okay, so the answer here is it is a bactericide. Okay, so that with that we sum up with the first mock test. So actually, how many of you attended the mock test? Okay, a couple of you have attended test. Okay, fine. Both the mock 1 and mock 2 you have attended, is it?
No, ma'am. One only.
One only. Okay, okay, fine. Okay. So how did you find this to be? You were able to answer most of the questions?
Yes, ma'am.
Yes, no, okay. So only thing that we have to see, what I have seen repeatedly is the questions, despite the fact that we do not have a set question paper or reference paper, all the questions for pharmacist exams is more or less similar. Maybe a slightly more, like a 4 or 5 more questions on structure, chemical structures have been asked, but otherwise more of drug classes or basic questions are only being asked. So what I realized is when we are trying to answer, we have to make sure, I think they expect us for our basics to be right. Okay, so that is what they expect a lot from us. So let us not think in a very complex manner. So try to answer in a very subtle and basic manner itself. So that itself will give us a lot of positive marks. And another thing is make sure you read the options very clearly, because some options are quite confusing. Even I took some time, especially for that sterile preparation of the eye, sodium chloride and purified water. Such questions are quite confusing, and questions where receptor level, like anesthetic, where is it acting and all. So all those things slightly on the percentage of incidence we will have to answer. Okay, cetrimide is a bactericide. I think somebody has asked the question. Oh. Yes, so is there anything that you have to ask?
Ma'am?
Yeah, Priyadarshini?
Ma'am, actually you said that abrasive agent is methyl cellulose, no ma'am?
Which agent?
Abrasive agent,
Yes.
dentrifies.
Correct.
Actually, I read in a book that is abrasive agent is calcium carbonate and phosphate, ma'am. Potassium carbonate. These two are abrasive agent, and methyl cellulose as a binding agent, ma'am. Which one is correct, ma'am?
Okay, so I will refer the pharmaceutic book and I will get back. Okay, so probably if we are having a class tomorrow, then I will tell you that, because I read it as an methyl cellulose as an abrasive. So I will just read through again and I will get back to you with that answer. Okay.
Okay, ma'am. Thank you.
Okay, fine. Yeah. So anything else you have?
No, ma'am.
No? Okay. So then I think we can conclude for today.
Okay.
So see when to have the second mock. Okay. So I think we'll discuss with sir and then I'll let you know.
Okay. Thank you.
Okay. Yeah. Okay. Fine then. Thank you, everybody.
Thank you, ma'am.
Thank you. Okay. Bye.
Thank you, ma'am.
Yeah. Bye.
Thank you, ma'am.